The Critical Care campaign is very important for Kootenay Boundary Regional Hospital and for our entire Kootenay Boundary region. Due to your generosity, we are 85% to our fundraising goal with $425,000 raised. The emergency room, intensive care unit, and high acuity response team are a strong and capable team that works seamlessly together to maintain the highest level of care for our sickest citizens. We're going to show you how far we've come since the Critical Care campaign has started and how your generosity has translated into equipment upgrades that save the lives of patients every day at Kbrh.
HEART recently received this handheld Doppler with funds donated by the Critical Care campaign for Kootenay Boundary Regional Hospital's Foundation. This device will help us to monitor our sickest and most unstable patients while we're on the move, even in very noisy environments like the back of an ambulance. Most people know what these do. This device is the electronic version. It lets us listen very closely without disturbing the patient, including fragile infants. We can listen to their blood pressure, especially when the machines get confused and they're not really sure what the blood pressure is. We can use a device like this to confirm those measurements and change the patient's treatment if need be. It also lets us tell vascular surgeons how much blood flow is getting to limbs that maybe have been compromised, and they need to know what type of operation or how soon they would have to intervene. Thank you for your donation. It is making a difference to all of the patients we serve.
The new trauma stretcher is X-ray compatible, which allows X-rays to be taken without having to move critically ill patients to another stretcher or out of the trauma room. The stretcher has built-in poles and overbed tables, which allow all necessary equipment to be carried so that patients can be transported safely to other departments through Kbrh. When patients are critically ill or injured, bleeding or wounded, it is critical that warmed fluids are administered as fast as possible as a life-saving measure. The IV warming pods allow 3 bags of saline to be warmed and ready at all times in the trauma room. The pods keep the IV fluids at just the right body temperature, which is ideal for resuscitation.
Good job, guys.
Now let's continue on to the ICU, the only ICU in the Kootenay Boundary.
We got a live one. Give her some more medaz.
One of the really valuable pieces of equipment that the Foundation has allowed us to buy is this Sonosite ultrasound. And what the ultrasound does is it gives us the opportunity to look inside patients' bodies using ultrasound waves. So it's a completely non-invasive, painless way for us to make diagnoses and do procedures with patients. One of the things we can do that you can see here is look at patients' blood vessels, which helps us to place large IV catheters for life support medication. It's a great advance over the state of care that we used to have, and it's really valuable in helping us look after our critically ill patients, and we really appreciate the Foundation's help in purchasing this machine for us.
The hover mat is an inflatable mattress that can be placed under the patient and inflated, so the patient is lying on a pillow of air. This allows patients to be moved from bed to stretcher to CT scan and X-ray tables with comfort and ease to both patient and caregiver. The mattress is portable and is identical to the ones used in other departments within the hospital, which makes the transporting of patients easier. New ICU beds are designed with specialty mattresses that can be set to change patients' positions at regular intervals. The patients not only get some chest physiotherapy with each movement, but they also prevent pressure sores from developing on patients who are unable to move on their own. These new beds also assist patients to a standing position. Early mobilization and therapy for critically ill patients is one of the standards of care that is promoted, and the new ICU beds will make that happen with the greatest comfort to patients.
This is the Glide Scope. It's a new piece of equipment that we've received through the Critical Care Foundation campaign. We use this in the emergency room and in the ICU. It's used by respiratory therapists and physicians to insert this artificial airway into patients who have difficulty protecting and maintaining their airway or with difficulty breathing. With the Glide Scope, it has a handle with a fiber optic camera on it, and we get a nice high definition image on our screen here, and we can then advance our tube into the airway and take over the patient's breathing for them. The foundation has also purchased us a state-of-the-art mechanical ventilator that'll be arriving shortly. These life-saving pieces of equipment are great tools for us to save lives at Kbrh, and we are very thankful to the foundation for their generous support.
We currently have $325,000 worth of state-of-the-art equipment either on site or on order at Kbrh. We are so happy that critically ill patients in need of advanced care are benefiting right now while at Kbrh. Achieving and maintaining a level of healthcare excellence is paramount at Kbrh. For that to happen, we need your continued support. Thank you so very much for being there for all of us. After all, you'll never know when you'll be in need of critical care. And if that happens, you'll be glad that they are here for you. We're going to show you how far we've come. Oh, stop. Translated into equipment upgrades that save lives every single day at Kbrh.
I totally just burst out laughing when she did that.
And how your generous donations have related into...
I could like hear this laughing going on.
The only ICU in the Kootenay boundary.
I gotta go. Oh, no, I gotta go. My bad.
ICU, the only ICU in the Kootenay boundary.
Give her some more Madaz.